Hello EDUSPLORERs, thanks for joining us again and welcome back to another exciting video on our YouTube channel. If you are joining us for the first time, we want to appreciate your time. For those of you who've been watching our videos, you would notice we focus on informative and educating content within the African continent. On today's episode, we are looking on how Africa loses and how the Western countries benefits from medical brain drain that ravaged the African continent. On today's episode as well, we will lay down to you the reason why Africa's medical insufficiency has also affected the continent, and more importantly, why the better environment for African medical experts. We will also explain to you why this strategy has affected the continent in a number of ways that needs to be looked at before things get worse. So without any much delay, we shall just dive straight into it. Africa bears over 24% of global disease burden, with only 3% of health workers to take care of the sick. Though this has been a perennial issue, the recent COVID-19 pandemic has further exposed the healthcare shortfalls in the continent. The lack of access to testing, shortage of lack of ventilators and also medical equipment hampered efforts to save lives at the peak of the outbreak. The exact number of African healthcare workers infected with COVID-19 since the start of this pandemic was hard to be calculated. However, as of July 2020, based on figures that exist, the World Health Organization reported that the number of more than over 10,000, which compounded to challenges and also shortages of medical staffs on the front line. A major driver of these shortages of healthcare professionals has been the increased medical brain drain as Africa's health professionals migrate in droves to developed countries like the United States, the United Kingdom, and Canada. The question here many are asking is, what is responsible for this, and also the reason why this transformation in terms of migration moving into those developing countries? That is the reason why we shall be looking at today. If you are new to our channel, we will encourage you to subscribe and share our videos to your different network. As recommended by the World Health Organization, the ideal doctor to population ratio is about 1 per 1,000 persons. But the reality is that Africa has a low ratio of its doctor, just over 5,000 patients. By 2035, the deficit is expected to be reaching about 4.3 million physicians. The United Kingdom, for example, with a population of just over 68 million people, has more than 370,000 physicians, while Nigeria, with over 211 million people, has less than 75,000 physicians, according to World Health Organization data. Many of the doctors working in the United Kingdom are from Nigeria, and the number of Nigerian doctors has been increasing. For example, more importantly, for instance, as of 2006, there are over 2,690 Nigerian doctors in the United Kingdom medical facilities or workforce, and by over 2018, looking at those figures behind, the figures looking at rising to over 5,000. By that end of a considered number, the UK was employing at least 12 Nigerian medical doctors every week, according to report. If you look at this transformation, as of 2016, the former president of Nigeria Medical Association said and estimated that over 8,000 Nigerian doctors were practicing in the United States. At looking at same figures in 2015, study has revealed that over 86% of African Education International medical graduates, looking at that in the United States, and also parts from physicians moved to different parts, also coming from countries like Egypt, Nigeria, South Africa, Ghana, who moved and never returned. Apart from the physicians, other U.S. healthcare occupational groups are also made up of high percentage of Africans. For instance, 24% of these registered nurses, over 20% of the nurses assistants, 16% of also personal care aides, aides, so to point out, are from the African continent. Canada also has a history of growing its medical workforce with African-trained doctors. As of 2019, the total number of foreign-trained doctors in Canada was over 22%, including those from Africa. Other countries include Australia, Saudi Arabia, and also the United Arab Emirates have also sustained their relatively high physicians to the population ratio by employing medical graduates from the African continent. If you are new to our channel, we will encourage you to subscribe and share our videos to your different network. Had this been a growing concern if you consider the current state of the African healthcare and the population? Has the African region really realized, or the continent itself seen that this is a growing trend, that if nothing is done, it could impact the continent looking at 2035? It is a growing issue that the continent needs to focus on. Otherwise, the impact will be beyond the growth in economic development. The driving force behind these particular challenges that the continent faces is the mass exodus in the search of greener pastures. If you consider what other medical doctors are pointing out, that they have left as a result of earning more money, and as a result of that, they plan to learn new things and also to practice in better environment. Other medical practitioners that have moved to travel, for example, to also encourage their own development and their own knowledge for consistency and to develop their skills. The job opportunities and the poor infrastructure in particular medical facilities and the bleak future for their own children are some of the factors responsible for the mass immigration of African healthcare workers. This long-standing issue has both medical and financial implications for the continent. Despite having just 16% of the global population, Africa accounts for less than 1% of total global health expenditures. And in per capita terms, the rest of the world spends 10 times more on healthcare than the African continent. The severe funding disparities impact usually on both its medical and personal facilities. If you look at that, on average, surgeons in New Jersey in the United States earns about $216,000 annually, so to put that figure into perspective, while their counterpart in Zambia earns about $24,000 and Kenyan physicians make just on average of just over $6,000. Look at the disparity. If we move forward, there are over 0.3 hospital beds, percentage of hospital beds per 1,000 persons if you look at Ethiopia compared to Germany with over 8 persons per 1,000 bed. There have been also cases of Zimbabwean doctors operating with bare hands for lack of gloves and other issues. At the peak of COVID-19 as of 2020, the Central African Republic, a country of about 5 million people, just over 5 million people, had just 3 ventilators, which is amazing. And also, for Nigeria to meet its healthcare infrastructural gap based on current figures, it requires an average of over looking at $82 billion invested in healthcare real estate, and also additionally 386,000 beds to attain the global average of just over 2.7% as per 1,000 persons. Is this a growing challenge that the African continent should focus on? I think so. For those of you who feel this is a big challenge, then we are able to look into this. That is an issue that the continent cannot ignore anytime soon. All those explains are looking at different ways. That explains why more African healthcare workers moved in droves out of the continent. Being highly valued immigrants in their country of destination, they have access to various immigration and pathways leading to permanent residence in those countries that they are moving to. This includes things like indefinite leave to remain in the United Kingdom, and also the employment-based green card in the United States of America, also which can later lead to citizenship by naturalization. Has Africa realized this challenge? If you feel that this is a big problem that the continent faces at the moment, we would like to hear from you. For those of you who feel that this is not a problem, we would also like to hear from you in the comment section. Has Africa been moving forward in different capacity in terms of infrastructure and other areas? Has the healthcare sector been abandoned in the past decades? We would also like to know why this is a major issue in terms of salary, training, skills, and also career development for African medical professionals. The brain drain has its impact in the continent hugely, and it's an area that is rarely talked about. So in this episode, hopefully we've been able to inform you with regards to the looming disaster, with regards to the African brain drain, and also moving its experts, and why Western countries benefit from the African medical brain drain. I want to thank you for watching EDUSPLORER. Hopefully we've informed you. We are looking forward to meeting you again soon. If you're joining our channel for the first time, we encourage you to check our other videos about the African continent. I want to thank you for watching. We're looking forward to meeting you in our next episode. So have a good day. Bye-bye.